Well, greetings and good morning. This is Dr. Bill Wyatt with the American Orthodontic Society. And we have a system of doing orthodontics now we call straight wise orthodontics rather than straight wire orthodontics. And this is just a better method of doing orthodontics than just a plain straight wire system. And we've worked out this where you can do something with every orthodontic problem that I know of, from the cradle to the grave, and it works on anybody here. You can learn this whole system from the starting, actually before people marry, where you have a large face person and a small one marry, and the offspring frequently or often will get the bone structure of the small person and the tooth structure from the larger person, and that just doesn't fit. And so you have to reduce the teeth just to do that. But let's get started now on this, showing a surgical case here that we did. We started in 1987, and I've got pictures of this lady now just a few month or two back from where we are right now. It's like 37 years, and this is a successful treatment of orthodontics. We've not had to redo any of these class 3 cases that we will show you. So let's get started, and I'll get going here with this. And we've got a lot to cover this morning. So let's see, we're already moving here. Here is this lady when we started this February of 1987. And it doesn't look all that bad. And there's this facial structure. You can see the chin protruding out here a little bit more than you should. And it looks worse when you get to the teeth. This is not a good view to get the orthodontic, show you the class 3 problem, but you can see later on how it works out. Now this is the models of the lady, and this is 2nd February of 87 that she came in with this problem. Now it's in a crossbite back here. These teeth are out in front right here. The upper jaw is out correct over on this side, but it's in a crossbite over the rest. And of course the midline is off and everything. There's several things. This is a genuine class 3 case. And this particular lady went to 3 or 2 for sure, and maybe 3 surgeons, and looked at this, and they all wanted to do the double jaw surgery on her, which she did not really want to get into that. So she came, finally we got to her, and we showed her where it's possible to do this and get a similar result that you would get with double jaw surgery. And I'll try to show you how we do that. Now, we do it by taking out lower 6-year molars on someone. And you pull these teeth back. You hook all this up, get it lined up, and then you come back with these teeth, and you hook up the upper 6-year molar here, and you pull with a class 3 elastic coming back like that. Then you can also, as you move these teeth forward into this, like this 2nd molar, we're going to bring it up underneath here, something like that. And so it can move forward, and we pull it forward by pulling these back. And when we get to where these are where we want the lower anterior, we put a pin and the bone here. We did not do that on this one. We didn't need to. And so you pull this where you want to stop with it, and you'd have to take it back to something like this. And now, most of these class 3 cases, the tongue goes forward in the lower jaw, pushing the lower jaw out front. And so I've had a lot of you needed to be redone simply because if they just worked on the lower jaw, they would bring it back and kind of crowd the tongue, and it would push it back again. Now this way we do this, it will move the upper jaw out. We use a lip bumper out here, going back in this to run interference. So as we bring these teeth forward, we carry the bone structure and everything with them, and we bring this out as we bring this back. And when you get this, these teeth are straight up and down. We're going to have to carry them back and bring their roots back. And if we're going in, it sticks out here, would be further out. We thought we'd have to do a genioplasty, but we did not have to do that. So let's get started on this case, and I want to go through and show it from start to finish. And this would shake up oral surgery. I'm not against oral surgeons doing what they have to do. Now, high angle cases, it doesn't work good. But we did one just to, the guy didn't want to do anything else. So let's get going here. On this side, we take out the 6-year molar. Now, this young lady had some periodontal problems, and we had to, in many of these, we have to widen the jaw out. We use a large arch wire, and we come out away from these teeth. And if you move them very far, you've got to have a rectangular wire there doing buccal root torque on these teeth as you bring them out. Now here, we're going to take these teeth out. And then we're going to move these teeth up about here somewhere, move these back about that point, like that. And this will come forward. We'll move these teeth, and then we also pull with class 3 elastics, and we'll line all this up in here. And when we get these where we want to be, we're recommending now putting pins in them, stop them where you want them, and then pull the upper teeth forward at that point without bringing these teeth back. And we can do virtually the same thing that you would get with double jaw surgery in here. Some people will question that, but we started out. This is after we were already going. This is taken in 1988. That's a year after we started. So we have this back under at this point of this x-ray. And then here this is where it was when we started. This is 1987. And then we're going to show that in 2024. That'll be 37 years from the time we started it to where it is today. Now, she had some periodontal problems, and we took these teeth out. This is a tooth that's got periodontal problem, and that's what we want to move up here. And so she did not smoke. If she was a smoker, I would not have been able to do this, I don't think. Now this is where we got started. This is 7 of 87 age, and at this age she's 24 and 7 months old. So here we start out, and we start pulling these teeth forward. We got to move these roots up here, bring that, and we'll move these forward, and we're taking all this and going back with it, and we'll pull with elastics from the top up here. Now that's she's 25 and 5 months at this point right here, and there we're pulling these teeth forward, and then we're coming back with these 8 teeth. These are going this direction, and these are coming up to a certain point, and we're using class 3 elastics, and we're moving these teeth forward. In here. All right, here we go through this, and we continue through. We had a little trouble with it. We slowed down once over on this side, and we brought this up. You see, that's the second and third molar here, and we're that close. So we've got to get these roots over here. All right. Here it is, age 28. We had her teeth over here, these teeth in place, and these in place right here. This had come back to where we wanted it, and we've taken the upper teeth out of the braces. Okay, we'll show it the way we did it now. This is a flexible wire. This is just regular orthodontics. We had to turn this tooth around. It's going to tend to strip, and you can't only rotate one like that without having a little stripping. All right, we go with that. I'm going to run through this real quick. That's just regular orthodontics. And here she was. And we were going, we got that tooth around part of the way. We're opening the gap. We'll rotate it. We're going to lose a little attachment right in that area. Now we're coming forward. We're pulling these teeth forward by elastic through chain in here, pulling them back. And we get this lined up better. We're going to use some elastics, pulling the upper teeth back. So here we go with elastic chain hooked in here, pulling the teeth back together. And we start, and then we're going to get into a heavier wire than that. Now we had to widen the up arch out, so we used a Big Daddy arch wire. We show that she had a crossbite back in here. And so we widened that with that, and we could put reverse tip in there if we needed to with a rectangular wire, which I normally recommend doing. Now the pictures weren't too good there. But here we have the wire rack in here, and we move these teeth apart, but very little. We didn't use a rectangular wire with a reverse torque in it, which I recommend that you do now. Now the side that had the periodontal problem, we were going a little slower with it. We got this tooth rotated completely here, and we'll have to rotate the cuspid there. Now here we are in this, it started in 87. Now this is on down the line. We're just about through in the case. That's 88. Now we rotated that tooth, and we got a little pocket there, and we'll have to bring that back. And then somewhere in here I've got this video with a lip bumper showing it. And during the case she gained a little weight, and then she lost that weight. She looked like this, just slightly had gained a few pounds here. And there we are going with it, and things looking good now. Now in order to bring these teeth forward, we used a lip bumper, and you run interference for the teeth. You get the lip bumper goes out here and leaves a gap between the tissue and the lip bumper. And that keeps all the pressure off of these teeth as they come forward. So the soft vascular bed has to go in front of the teeth where you keep the root structure coming out with the teeth. And we roll this lip bumper and we expanded it. You can see where we've opened the loop in the lip bumper, bringing it out, and it's just sitting right above the tissue, coming out like that. And that brings these teeth, you can bring them forward. Now these down here, we're tilting the roots back and bringing them back further, which I'll show on the x-rays in a little bit here. Now there's the lip bumper. You can see where we expanded that loop as we went along to bring those teeth out. And so we're advancing the upper teeth. At the same time, we're reducing the class 3 situation with the lower teeth out like this. And you don't need all this stuff to bring this up. You bring it up and then you pull these back by bringing the upper teeth forward in here. And if you want to bend it more, you can just straighten this out down here and put pins in them and bond these pins to the teeth and now pull the upper teeth forward without bringing this back. Okay, this is, I don't get the date on that fully, but we're just about to finish the case up. And we've got this lip bumper running interference as we bring the teeth out. Now we get this out where we want it, and this is like 2000. Well, we got it quicker than that. We finished that out. It didn't take us too much, over a couple of years, I think, to finish the case. Now this is 91. See, and we started this in 87. So we did work on her for, it's January the 30th of 91. And we're still working on the bottom arch with that. But the second molars now, these are second molars and wisdom teeth, right here. Now we did this, it took time to do it, but we did not have to do any surgery on that. And we got a real similar result, and this is going to stay. Now that's 91, we've got our chin back now. Somewhat still with just a slight protrusiveness of the chin. And there's her smile at 91. And there we are at 87, and there is 91. We had it finished at that point. And she's wearing a retainer. I have a retainer here that I'm holding up here, keeping these teeth forward where they came out. And we have advanced these teeth and without losing bone structure on them. The tooth down here is looking better. She needs to keep it cleaned out much better. Now this is just the side. We took this tooth out, and you don't see that at all if you look at her case. On the other side, the same thing. Here the upper arch is, and you can see how much wider we brought the arch out. We take your big daddy arch where you can do whatever you want to with it. If you expand them very much, so you've got to come in here with a rectangular mouth wire and put buccal root torque in it, and that carries the tooth out bodily to the side. Now there's the lower arch, and there's how much larger we developed the lower arch. Even though we had reduced the teeth, the arch was still wider in here, and the upper one's wide enough to go around that. And this is 91, and this was 87. That's at that point. Now, we were proud of that case, and I was very proud of what we did on this. And you notice all these teeth are lined up now, and this is stable. It has stayed there. Now here we finished her up. This is about 91, I think, something like that. And this is the smile picture there. And there it is, the vertical. We thought we'd have to do a genoplasty, but we didn't. We brought the teeth back and just left the pagonian out. And it looks good. And here it is after we've treated it that far. This is after, I don't forget the date on this, taking these pictures. But this has come out, these teeth are back, and we have to show the x-ray to show you where they are. All right. This is done in, that's number 3 x-ray. And this is number 11 x-ray, where we took her way on back. In other words, these upper teeth are just hanging off the back, and she can leave them if they don't bother. And this is the wisdom tooth and the second molar right here. You got a little bit gap left in that, and that's number 11. That's in 7 of 010. As again, the similar picture. And here is the models in 87, and here are the models in 010. It slipped some on us, but not much. And that's the starting and the finish part of the case there. Here again, the upper arch the way it was, and we widened it out, and you can see this is 010 right here, and this was 87 or back when we first started. There's the lower arch, 010, and we took those teeth out and brought them forward, and it's still broad. This looks broad here as we bring it up. Now, this is what I wanted to show you at the end of the case, where we brought these bottom teeth back bodily. I mean, that's the roots coming down like that. I thought we was going to have to take the chin button, bring it be a bit protruding. Here's where the chin button was when we started. Going in, and it's push the teeth back that far. There. Now, here is the case we started in 87, and that's about 2010. And here is 2087 and 2010. Now, we got pictures of her just the last couple of months, or maybe just a month ago. She's a good friend of a friend of ours, and she was there, and I said, man, take me a picture of her. And so here she is, 37 years from the time we started. And this is what it looked like when we started, and here she is 37 years later. That's what we did without doing any surgery, especially double jaw surgery. Now, I've scrubbed in on double jaw surgeries, and they work okay, but this is where you take the whole maxilla loose and you shorten it. You can control the vertical height, which we didn't have to do. This is the vertical height is be the same. I think that's the last picture we've got here, but I appreciate you watching this, and we're going to I'm going to come back and show you about 6 or 7 or 8. I've got 10 or so, maybe more cases that I've done over the years with this type of just removing the 6-year molars, treating the case. And if this works, I think people ought to find out about it. This will save people doing double jaw surgery or any kind of surgery on doing many class 3 cases by taking out the lower 6-year molars. I'm going to show I've got about 10 or 12 of these cases where we took the 6-year molar, and they've all held up. They have not had to be redone in any way, fashion. So thank you for watching. I think this is the end of the show, but this is a lady 37 years later. The teeth are like that. And so thank you, and I'm going to hang up here, I think.